Welcome everybody to the third session of our COMBAR working group meeting. As you know, yesterday we had a session on diagnosis. This morning we had a session on the socioeconomic aspects, and now we will start our third and last session on sustainable control. As I often say, the third working group is the most challenging one, because the aim is that we here bring all the pieces of the puzzle together and in order to achieve sustainable parasite control. With that, I would like to give the word to Eric Morgan, who will take over and chair this session. Thank you.
Thank you, Johannes. So I'll start without further ado the session on sustainable control. We have a keynote coming up and then a series of talks around various aspects of complementary and alternative control, including plant-based approaches, biological control, grazing, and vaccination, following in the same way as working groups 1 and 2, following that with a moderated discussion. I'm going to start with a few slides of introduction from myself and from Hervé Host, co-leader of Working Group 2. I just want to remind you about Mentimeter. The code is in the chat box for this session. It's 1142113, and you'll be asked 3 questions, and then you'll be able to enter your own questions for the presenters. And in between presenters and during the panel discussion, then the chair will be able to read those out. Again, we won't be able to cover all of them, of course, but we will do our best. So Working Group 3 is indeed challenging. It deals with the objective of developing practical and sustainable helminth control strategies, integrating insights from the diagnostics, targeted treatment and targeted selective treatment approaches, epidemiology, vaccinology, and the farm economics and farmer behavior. So it's a big challenge, but we don't aim to completely reinvent this field. We just want to take some of the insights from the other working groups and from our own efforts into a more integrated view of helminth control on farms now and in future. And Hervé Host is co-leader of this working group, and Smaro is kindly helping us to co-chair today. We break down the aims of Working Group 3. Some is database driven to try to collate information on these alternative control approaches, and importantly, the evidence for their usefulness, but also around the variation in their usefulness, and to start to broaden the concepts towards how we integrate these different control approaches in an effective manner, especially in livestock systems in Europe. Evaluating impacts of future changes, importantly, we'll use in silico approaches and epidemiological modeling, and we're well advanced with these 3 tasks in green. So last month, for example, we held an online training school, was very well attended, around the principles and practice of modeling parasite transmission under climate change, with a specific intention of bringing empirical-based researchers into the sphere where they can start to explore the usefulness of their new control approaches in this context and not rely only on specialist modelers to do so. The further tasks we will be focusing more on in the next year, many of you are already involved and some others will become involved, to conduct gap analysis of decision support tools and the needs for them, and to report on best practice guidelines. But recently we've been discussing more, should this be a basket of options that is suitable in different circumstances rather than a more narrow best practice set of guidelines. So in a couple of slides, I just want to revisit why current control is not sustainable. And I think it's clear, if you're here, you know already, the whole action is about anthelmintic resistance. We cannot ignore it, it's growing. It poses an existential threat, especially grass-based livestock production worldwide, and no less so in Europe. But there are other reasons. For example, even within the production cycle, excessive reliance on anthelmintics can interfere with the development of immunity, and excessive reliance on anthelmintics also has promoted genetic selection of breeds that are not very resistant or resilient. These other reasons, though, climate change, environmental impacts, food residues, they've always been considered, but in the past they've been considered as an add-on, as a mention after these main reasons for lack of sustainability. And actually their importance is growing and they are more complex. So climate change, for example, might increase infection pressure, but it will change seasonality and predictability of infections in different ways, in different places, and increase between year variation in epidemiology. Environmental impacts, again, we have more than one direction here. So maybe effective anti-helminth control, or effective helminth control has a very important role to play in limiting greenhouse gas emissions from livestock, but at the same time, the tools that we use to control these helminths could have their own environmental impacts, notably, for example, on the effects of anthelmintics on invertebrate fauna, and also in environmental manipulations such as drainage. Many of these must be viewed through a prism of regulation and consumer choice, and that means we have to integrate this with other considerations like land use, policy priorities, and animal welfare. So we must move towards a much more holistic consideration of parasite control. What is clear is that we cannot any longer rely on anthelmintics as the first and the last choice when we come to consider parasite control. For sure, they will continue to play a role. So this was one of our first outputs from Working Group 3, a paper led by Joseph Cruza, who is here with us today, trying to reimagine a future where we don't use anthelmintics in the same way. We use them as therapeutic interventions rather than preventive control. It's very difficult to imagine such a world. This is where we are going, though. Fortunately, we have viable alternatives, such as vaccines, biological control, nutraceutical forages, breeding resistant livestock, and grazing management. Intensive research in these areas, and many of you are involved in that research, which is making inroads. What is clear is that these are all partial solutions. None of them will completely replace anthelmintics as a standalone single control approach. And so maybe rather than alternatives, they should be considered complementary to each other, or complementary to anthelmintics. This raises difficult questions around how to consider and test the best combinations. If we can't use a single one of these only, then we have to be mindful that they might interact. They might interact directly. For example, diet affects anthelmintic absorption. They might interact indirectly and around the farming system and around the climate. So these would be very specific interactions in different contexts. And again, in silico approaches such as epidemiological modeling can explore those interactions and can start to design and support efficient field trials where we don't have to only rely on very expensive and difficult trials replicated across years and across locations to at least start to build better integrated approaches to control. The second point is that where we are bringing in other complementary control approaches into a system that is very much evolved for setting standards and testing effectiveness of chemical anthelmintics, we come against the problem of how do we standardize or set standards at least for the effectiveness of these different control approaches. And this is where I'd invite Hervé to say a few words.
So as Eric mentioned, one of the challenge currently for this WG3 is also to analyze the gaps to implement this solution, alternative solution on the field and in farm conditions, and also to try to define better a range of basket of options. And basically the idea is that pharmaceutical companies, besides providing a range of very efficient molecules, at least before the rise of anthelmintic resistance, they have also provided a grid to evaluate these commercial anthelmintics. So it's a sort of frame of reflection and grid of criteria to evaluate both the scientific issues and the research and development issues. And the idea with Eric is to evaluate whether this grid can be applied also on alternative solutions. This grid being basically a sort of reference and model for scientists, but also for farmers, probably. Next slide. So this is just a detailed description of the different criteria which are taken into account in this evaluation for synthetic anthelmintics. On the left, you've got the scientific issues with the quality of the product, efficiency and multivalence against different worm, what is called broad spectrum anthelmintics, knowledge on the mechanism of action, food safety, and safety for the animals. And on the right, different conditions to increase and improve the implementation on farms with very well-defined conditions of applications and what is taken into account to facilitate the application on farm in regard of the farmer point of view. And of course, regulation bodies are very important to consider. Next slide, please, Eric. So basically, this is again a description of the different solutions which are classified according to different targets. Some solutions which can be used in alternative control are related to an effect on the parasitic worm populations, modulating the biology of the worms. A second set is the possibility to improve the host response, and the third set is to try to limit the contact between the animals and the free living stage, with different solutions which have been exposed previously by Eric. And of course, as underlined, this should be integrated, and this should rely on a combination of the different solutions with the help of modelization. We think we can arrive with this sort of grid of analysis to identify the gaps and to identify also different basket of options within a time frame. Thank you, Eric.
Thank you, Hervé. So at the end of this session, we'll have a discussion with panel members. But first, I would like to call upon our plenary speaker, Barbara Cyrus, who graduated from Free University Berlin as a vet and then also took her PhD there. And for some time now has been at the European Medicines Agency, involved with licensing of medical products. And she's going to talk to us about regulatory aspects of new anthelmintic veterinary medicines. And perhaps that will be a framework for our discussion later on how we approach similar routes for alternative and complementary approaches. If I would invite you to share your screen, please, Barbara.
So first of all, thank you very much for inviting me. I think COMBAR is a really impressive cooperation of so many different disciplines, and I'm quite glad that the regulators have also a little bit, hopefully, to contribute. What I would like to do here is now give you a little bit of a crash course in drug licensing, because quite a few of the studies that are ongoing might contribute to eventually getting maybe a medicine developed, and then focus on those bits that seem to be very novel and where just give you an overview where we are in this regard. So first of all, you heard that I work for the European Medicines Agency, which is the licensing body for veterinary and human medicines for those medicines that will be licensed all across Europe. I think you've all heard about the COVID vaccines, and they are the ones that will also be evaluated via the EMA. The EMA is now located in Amsterdam after about 20 years or more in London. And what we're mostly doing is coordinating the research and the scientific input across the member states. That little picture shows you the EMA. So it's half offices, half meeting rooms, because we do have a huge amount of committees. These are the main committees. The yellow one is the one responsible for veterinary use. And all of these committees are supported by working parties, expert groups. So it's a huge network of experts all across Europe we are dealing with here. Now, when it comes to the licensing, there are different routes how you can get a medicine on a market. The one we are dealing with here is what I'm representing is European, the centralized procedures. That means one application to the EMA, and eventually that will be medicine that is licensed or available all across Europe. But there are also national procedures possible, where only one or a couple of member states are involved. For you to know is that recently, well, last year, the veterinary regulation has changed, amended. It will come into force or into effect January 22. And a couple of areas have been changed here, namely antiparasitic resistance has a much higher impact now than it had before. There's some incentives to develop medicines that reduce or try to reduce the risk of development of resistance. But there are also some assessment issues that need to be considered. So all this legislation is published on the website of the European Commission. I put in here links if somebody is interested. What the EMA is doing is all the publishing scientific guidelines that can tell researchers how to do their tests in various areas. And not only in regard to European requirements, but we also do liaise closely with other regions. And these guidelines, they're called VICH guidelines, will also apply in other regions of the world, like the FDA, in America, Canada, New Zealand, Australia, Japan. So there are a couple of guidance documents that are not just European ones. We also publish the outcome of any medicine development, and this could be possibly of interest for you if you want to see how somebody else has done it, what sort of parameters have been used, and what did the authorities think about it? Is it enough or not? Now, what needs to be registered? And I've heard a lot of talks already today and yesterday about various bits. Obviously, what needs to be registered is a veterinary medicine. And what is linked to a medicine is what is called a maximum residue limit. And this is something that is only for veterinary medicines. On the human side, they don't have anything like this. I come to this a little bit later. There are also other products that need licensing, but they would not fall under the veterinary medicine legislation, although maybe the active substance is the same that is used. So you might have biocides, something like disinfectants or things that are used in the environment of an animal. They would not fall under the VMP legislation, but under the European Chemicals Agency. Likewise, feed additives like coccidiostats, they are handled by the European Food Safety Agencies. Medicated feed is a European Commission remit. And then there's a whole range of products that have no clear European licensing requirements, but there might be member states level. So these could be the medical devices at something like syringes, bandages, but also all these test kits. I've heard a lot about test kits, so they would not be considered as a medicine, but it might have something that you might need to check with a member state, but they have a national rule on these ones. Diagnostic tests or nutraceuticals as well. There is a gray area, and there is not this would not be a medicinal product. So whenever you think about developing something, it is useful to check what it is you come up with to make sure that the requirements follow, the tests follow the requirements. Now, as I said already, a maximum residue limit is something that is necessary. And this is not something you can touch. It's just a figure. It's a number and a value that is necessary for food-producing animals, and gives you the maximum amount of a residue of a drug substance that is allowed in any food that is derived from a food-producing animal: fish, milk, honey, eggs, and so on. Independent how you want to license your medicine, whether it's only a national procedure or the centralized one, the MRL applications need to go via the EMA, and any results will later be published in the European Commission's official journal or on our website. And the reason I'm mentioning it here now is that this can take quite a long time to develop. So if you develop something for use in, I don't know, fish, make sure the MRL is in existence. Otherwise, it adds up to a huge, big data set you might not have available very quickly. And how can you check that? Either the Commission's website or here, this is the EMA website. Unfortunately, the search, you have to search for medicine and then click veterinary and the EPA. So you find all these different results for a certain substance. And what you're looking for is a table like this. So that would give you the pharmacologically active substance, the animal species, and the target tissues, which are of importance. So if you think, oh, this is all fine, levomersol is sorted, you will see that this does not include fish. So you will have a problem here. If you want to have a fish medicine developed, you would need to find an MRL first. And likewise, the target tissues are important, because if there is no MRL for milk or eggs, honey, then you wouldn't be able to use this one. You will be able to use it in ovine, in cattle or in sheep, but not in those that you wouldn't be able to use the milk for human consumption. So this is some bit to consider. When it comes then to the medicinal product as such, you have to provide something called a dossier. And that dossier has 4 parts. Part 1 is all the administrative bits. addresses, contact details, who is doing what, and this sort of administrative information. And the three parts where you actually need to provide data is the quality dossier, a safety, and an efficacy dossier. What we get is only data. We do not do any tests in the agencies. You've seen the photo before. This is just offices. So it's sometimes misunderstandings, or the regulatory authorities only assess the data. We do not do any animal tests or laboratory studies. And when it comes to the decision on a medicine, this will be taken on a case-by-case basis. So each product will be judged on its own merit, on the risks and the benefits. And with the new veterinary legislation, as I said, this has recently changed. The risk anti-parasitic resistance is clearly mentioned in here as a risk that should be taken into account. So the pharmaceutical quality is something like a cookbook for medicine. So it tells you, you should provide information about where every little ingredient comes from, how it is put together, how it is mixed, where it is mixed, in what sort of container it is put, and so on, up to the labeling. Really, all the details, how the medicine has been developed, should be included here. And one thing, again, in red, I put it up. For certain manufacturing sites, we would need a GMP certification for veterinary use, and this can sometimes take quite a long time. So we had a couple of times smaller companies had problems getting these. They were not aware that how much time is needed to get the certification into place. It's something, it is good to know that in advance. The quality requirements are very similar for human and for veterinary medicines. And for the safety dossier, up to a certain degree, it is the same. So for the safety, we would need to have data, usually laboratory data, good conditions, GLP conditions following OECD guidelines, either from new studies or from peer-reviewed literature. And this is general information about the pharmacology, the toxicology, mutagenicity, carcinogenicity. That's a sort of basic information that is needed. But specifically for veterinary products, you also need something that's called user safety, which basically addresses anything to do with humans. It can be the farmer who is mixing the medicine. It can be the veterinarian. It could also be your neighbor who's touching a dog that has just been treated with a spot on and is not aware of it. So that's a user safety assessment, and it's usually based on the most susceptible or vulnerable population, which is small children. The environmental safety assessment will need to see how the medicine or the residues, the metabolites of the medicine will fare in the environment. And that should then allow conclusions on for instance, warnings in regard to parasites, ectoparasites used on a dog. Can the dog go for a swim in a pond? Can the dung beetle still happily munch the leftovers, the feces of cattle grazing on a pasture? That's the sort of information the environmental safety assessment will give. And obviously for food producing animals, you will need to have withdrawal periods established for whatever food is produced by this animal. In regard to antimicrobials, you will also need to address the risk of the development of resistance in the human gut flora. Likewise, the efficacy dossier is also split into two parts. One, the preclinical part, requires as well pharmacology data, but these will be specified for the target species. And this includes pharmacodynamics, pharmacokinetics in the target animal, but also resistance data. So I flagged this up. This really is a requirement in Europe for companies to investigate the mechanism of action and to provide data. What we would ideally like to see are recent data from various regions across Europe, and representative, of course, it is not always possible. And this is a resistance section applies to antibiotics and antiparasitics, and obviously antibiotics have more options available, but in principle, this will be the same for the antiparasitics now. We do require tolerance studies, and these are usually overdose studies in healthy target animals, which will later on be necropsied, and the data will then be used to identify potential target organs. Obviously, this is not a study you can do in people, but because of the veterinary side it can be done, this will later on result in considerably smaller field studies on the veterinary side. So if you know already what target organ can be affected, that can be easier observed in the clinic later on. Dose finding studies will include artificially infected or infested animals with different levels that will then be treated or exposed to different levels of the medicine. And that should allow you then to develop the proper dose, the best dose with the least adverse events. You mentioned already in silico data earlier, and obviously all these preclinical and safety data, there are various incentives or possibilities to not do these tests in animals, but to have some replacement tests, calculations, and so on. And finally, the clinical part, the clinical studies, what we would like to see are here field trials in the target population. And with target population, we mean the age group, the breeds, the animals that are intended to be used in practice. And ideally, a mix of different animal husbandry conditions that are representative for Europe, geographical locations. It will depend a little bit on what sort of medicine it is. If you use a heart medicine in pets, the conditions are pretty similar in the US, for instance, and in Europe. So you would accept data from America, but for field trials in terms of antiparasitics or anti-infectives, we would really want to see the EU data. I was asked to speak about the new medicines, but just in terms of the efficacy, once the medicine is licensed, we will have every medicine will have a very, very thorough monitoring. And the lack of efficacy is one aspect that veterinarians are asked to indicate for a medicine. This could be the reason for resistance development. And we do also always encourage veterinarians to let us know about these, because obviously the license will eventually end up based on the clinical studies that are submitted in the beginning here. Now, this is mostly for anthelmintics, what I've said so far, for pharmaceuticals. And for vaccines, we will have a similar approach in principle. So they would also need safety, quality, and efficacy data. The European monograph is a pharmacopoeia, also has certain monographs which vaccines might need to follow. But currently there is no specific EMA guideline available for any vaccines. The nearest you could find is something on coccidiosis, but this is not really an anthelmintic right now. There might be specific requirements if you speak about live organisms, or if the vaccine is manufactured using genetically modified organisms. There will be additional safety requirements in place. What usually is not necessary for vaccines is withdrawal periods, but it should be addressed in the dossier, and it might be that not the active substance is here of concern, but there might be some adjuvants or some excipients that could play a role. Having said that, it is recognized that it is a good alternative solution, but so far in Europe, we only have one medicine license, not centralized, but this is a national authorization. There are two others in Australia, South America, and South Africa, but they don't have a license, full license in Europe, as far as we could find out. The specific considerations here, and I would like to point out to this publication here from Edwin Clairvaux and Peter Geldhof. This is a brilliant overview on where we are right now, because we are not very far in regard to licensing, and there is like quite a bit of a problem or challenges in the vaccine development. We all know there are different life stages in parasites. They all have their own antigenic profile. The host-parasite interaction that mediates immunity is not fully understood yet. And then I think the manufacturing, the scaling up to commercial batch production is something that is also a problem. You probably all heard about the problems for the COVID vaccines to get the appropriate numbers of vaccines manufactured. And this will be exactly the same for veterinary vaccines. So the manufacturing at large scale is always a bit of an issue. The research focuses not on development of vaccines against the live parasites, but more the subunit, the recombinant subunit vaccines that will then be strengthened with an adjuvant. Myself, I'm not very familiar with vaccine development, I have to say, and a colleague of mine, Javier Pozo Gonzalez, helped me with the slides here. So I hope that the colleague, Edwin, that you can answer any question that comes up with vaccines, because this is not my, area of knowledge. Now it comes to even more limited knowledge, which are the novel ones. Johannes had asked me to address the plant-based and nematode-placed products, and there is really nothing I could say to you because there is nothing licensed yet. If it comes to plant-based medicines, the approach that could be taken is, it depends a little bit what the plant-based is. So if it's a herbal medicine, if it's something that is created by a mix of herbs or a single one, there are herbal medicines available on the human side, quite a lot of them. There are a lot of guidance documents available. So in principle, the same principles would apply here as well. They would need to have a quality, a safety, and an efficacy profile, but the quality profile would need to follow the herbal guidelines. And in particular, if you will have a product for food-producing animals, it might be challenging in terms for an MRL to be established beforehand. The nematode trapping is even more complicated because so far the veterinary legislation did not consider biologicals as such. This is different now with the new legislation. There is a new option now for a biological to be approved. And with colleagues, we discussed this issue, and the nearest we could come is to give you reassurance. Yes, we could probably consider nematode trapping as a biological that could be licensed. There is a similar approach on the human side where leeches are licensed for medical use, but in the absence of any clear guidance and experience with this one here, there is nothing published yet. And what we always encourage in those situations is seek early dialogue with licensing authorities. There is quite a lot of willingness on the side of the authorities to get into dialogue with applicants very early on. And I can only encourage you to approach authorities if there is an idea. Now, in summary, what we would recommend is check the websites of the EMA for scientific guidance that is already available. Also, you might need to approach, if you want to have national information for instance, for clinical trials, you will need to approach the countries where you want to conduct those trials. So there is a collection of contact details with the heads of agencies in the different member states. And the last big advice I would give to everybody who starts from scratch and is not a member of a big pharmaceutical company, work together with a veterinary consultant. It's really difficult to know all these details. It's a very complex field, and we would always recommend a consultant to contact. As an example, I wanted to give you a quick overview of the guidelines we develop here and just point out a few of the documents. We do have a good clinical practice, a GCP guideline, but also statistical principles. Statistics plays a big role, and this is something really to bear in mind. The target animal safety is mentioned here. And then it comes to anthelmintics. There are lots of anthelmintic guidelines developed at VSEH level. All of them are currently under revision. So we hope that a new revised documents will be available maybe next year. We don't know yet, but they have been under revision for a while, and we hope to finalize this revision eventually. What the EMA has also published is a reflection paper which reflects the current state of scientific approach in terms of resistance, which might be of interest for you. These are the different types of assistance you might come across. So in particular, the meetings with agencies or innovation task force, scientific advice, these are all approaches companies could choose early on to check with the authority how to get the license done. And finally, this is my final, it's not so much the regulatory aspect, but if somebody is very interested to see what regulators are doing, the EMA is also offering traineeships for recent graduates. And this is the end of my presentation. I'm happy to answer any questions. I hope I stayed in time here, yes. So.
Thank you very much, Barbara. You're spot on time. We started a little late and that's my fault and not yours, but we can program. I think it's a great opportunity really for the researchers in this group to speak to somebody across the other side of the desk. So we've had a lot of interest in Mentimeter, and the winning question is, will there in the future be a requirement for companies to provide assays or protocols or tools to test drug efficacy in the field post-registration of their new product?
If you go to this, there is something called summary of product characteristic for anthelmintics. We do have label recommendations, what goes into a package leaflet and so on. And it will be, of course, impossible to give a protocol for each individual situation. But in general, if you have a look in some of the recently authorized products, there's usually some prudent use warnings. And there is a focus that for instance, the disease should be established in the herd. How it is established is so specific, it is impossible to make it product specific. That's my personal view. There is certainly an incentive that it should not be used preventatively on a routine basis, but there should be some sort of prudent use considerations behind it. I don't know if that answers the question. It will be too detailed to have a specific approach in here. And if you have a clear, if this reflection paper gives quite a good overview on the different approaches that could be possible and the limitations the system will have.
Thank you. It's hard to know if that answers the question.
Yeah,
because it's not my question, but I guess once something is licensed, right? So if you then get resistance, it becomes less effective, but at no point do you then rescind the licensing?
What I tried to say before, so once the medicine is licensed, there will be a monitoring in practice happening. And I don't know if you get veterinary records or these information on a national basis. Some of the licensing authorities publish recent findings. If they get a lot of adverse events reported, for instance, these adverse events will eventually be reflected in the package leaflet and the labeling and so on. And likewise, if there is a lack of efficacy, and if there is a real risk for resistance development, if there is clear indications for a risk, and this has been discussed, then yes, there is a possibility to change the labeling and the package leaflet. But it would be a separate procedure. And I think if you have a general look into anthelmintic licenses that are fairly new, you will find a lot of warnings in there, which in the olden days, 20, 25 years ago, when I first started working in the regulatory authorities, there was not much of warnings available.
Thank you. I can roll two questions into one next. There's a question on what aspects of environmental impacts do we have to consider in anthelmintics? And as part of that, is there an EMA requirement actually for environmental impact assessments for veterinary medicines?
Oh yeah.
So that during your talk.
This is not only a EMA one, it is a VICH guideline as well. All these VICH guidelines are on a more global level. It is part of the safety dossier. My background is efficacy, but where you find, if you go to the EMA website, you have the efficacy requirements and the safety requirements, and all the environmental risk assessment guidelines will be published here. So for VICH, for the ERA assessment, there are two phases. There's one approach that's usually used for pets, and another one is for food producing animals. So it's very, very long explanations how the assessment is based, but it is something, there is guidance available, yes.
Thank you. And the final question is very specific and very popular. So how will the new regulation 2019/6 of the European Parliament on veterinary medicinal products address anthelmintic resistance?
How it is addresses? Well, there are several parts where it is addressed. There is, for instance, as I said, there is the option. There are several places where it is addressed. How it is implemented then by the authorities is another one. The legislation is on a higher level than what is happening then in practical terms. And there are lots of committees and groups right now working on it still. All I can say is that the actual text of the legislation is done, it's published, and some areas, for instance, the prescription is something that is mentioned. The prescription for veterinary medicines for food-producing animals must be prescription only, and it can be moved from prescription only to non-prescription under certain conditions, and the antiparasitic resistance is one of those issues. The new legislation provides some incentives in terms of longer data protection for variations that reduce antiparasitic resistance, but details on how a company has to do it, these details are still being developed. So I don't know if that is clear enough, so I can rumble on here about the risks, but without knowing the details, it's difficult. We had a very challenging year, and yeah.
Absolutely. Thank you very much, Barbara. We'll call time there if you could stop sharing your screen, please.
Yeah, sure.
And thank you. It's very informative and particularly useful. I think that you've included the links to further information in your presentation, and that'll be clear in the recording also. So much appreciated.
Yeah. If there are specific questions, I'm happy to answer them. My email address is in the presentations, but I understand this is limited here. So yeah. But
Marvelous,
anyway, thanks.
thank you. And any unanswered questions in the Menti, we will attempt to get a reply to people. So we move on to the general session now, and I would like to introduce first Fabio Castagna from University Catanzaro, who will talk to us about some macerates and effectiveness against gastrointestinal nematodes. Thank you very much in your own time. Oh, it's Antonio presenting.
Yes, Eric, I present me short communication, sorry.
Thank you.
Yeah, thank you. I am Antonio Bosco. I am a postdoc of the University of Naples Federico II, and I present a field trial to evaluate the anthelmintic efficacy of the Aqueous Dryopteris felix mass and Punica granatum macerate against gastrointestinal nematodes of sheep. As we know, there is a threat of the reduced efficacy of anthelmintics against gastrointestinal nematode, as in southern Italy, where we report recently the reduced efficacy of benzimidazole in 2 sheep farms. The anthelmintic resistance is an increasing problem that imposed the need to explore and validate the novel solution for a sustainable control of helminth infection in ruminant. In many countries, including Europe, plants have been used as a fork medicine for parasite control in small ruminant. In Italy, many plants were used in livestock farms, and this tradition have survived in some areas as Calabria region. In Calabria region, located in southern Italy, some sheep farms use traditional plants to control of helminth infection, including pomegranate and merfer. So a scientific validation is necessary before adapting them as a new method for parasite control. So the aim of this study was to evaluate in vivo anthelmintic activities of aqueous macerate based on the merfern plant and fruit and peel of pomegranate against gastrointestinal nematodes in naturally infected sheep. The trial was performed in a sheep farm located in the Calabria region with 500 sheep of local breed for mixed milk and meat production. The traditional blend tested in this study were performed according to ancient and ethno-veterinary recipes handed down for centuries from generation to generation, as follows: extract of myrrh obtained by maceration in water, and extract of pomegranate obtained by maceration in water. A total of 45 sheep naturally infected by gastrointestinal nematodes were selected and divided into 3 homogeneous groups of 15 animals each. The first group was treated orally with 15 ml of the myrrh macerates. Second group was treated orally with 50 ml of pomegranate macerate, and the control group was untreated. At day 0, we allocated the 3 groups. We collected and examined the fecal samples, and we treated the animals. At day 7, 14, and 21, fecal samples were collected and examined to evaluate the anthelmintic efficacy. Individual facts were analyzed using FLOTAC technique with a sodium chloride flotation solution, and a larva culture were performed to identify the gastrointestinal nematode genera. In this farm, there were Trichostrongylus, Hemoncus, Pterodorsagia, Schabertia, and Coperia, and the egg count reduction was calculated. So, the results showed that anthelmintic efficacy of myrrh was very low at all time, as seen from table, while the anthelmintic efficacy of pomegranate was higher, with the fecal egg count reduction values of 15 at day 7, 44 at day 14, and 40 at day 21. Analysis of pomegranate aqueous extract was performed by the Department of the Chemistry using electrospray ionization mass spectrometry. In this table, we report the chemical characterization results of total drug extract, and these analyses identify 6 peaks with the respective analyzed. In addition, from drug extract, we obtained 3 fractions: methanol, insoluble residue, and gallic acid that we used to perform AGH test. In vitro results confirm in vivo results. In fact, all fractions produce a significant ovicidal activity against the gastrointestinal nematode at all concentration. The anthelmintic activity of pomegranate is probably due to action of the component identified with the chromatography analysis. The results obtained in our study are in accordance with the other in vitro and vivo studies, and other studies indicate that pomegranate has a significant anthelmintic activity and improve the antioxidant status by protecting the host tissue from helminth infection. In conclusion, the in vivo results showed an alternative ineffectiveness of myrrh and low anthelmintic efficacy of pomegranate. Despite this, the use of aqueous macerate based on the fruit and peel of pomegranate with fecal count reduction values above 50% could be an alternative or complementary to drugs for gastrointestinal nematode control. in sheep. Thank you for your attention.
Thank you very much, Antonio. We have some questions. The first, so how did you decide the dose rate, the concentration of the macerate?
Okay, the concentration, the dose, we use this dose according to sheep farm that we use by many years. In fact, this recipe have been handed down from generation to generation.
And was this just one dose, Antonio, not every day?
Yeah, no, we use only one dose.
Uh-huh. And this has to be as a dose. It's not palatable, so you have to give it as a drench. You don't let the drink.
Yeah.
You know. Good. We have another question. It'll be the last question because it has more votes. So how do you evaluate the zootechnical performance and any toxic effects on the host?
Yes, but when we use in a single dose, we don't see the toxic effect on the sheep.
Thank you very much. We'll move on now, Antonio, and I'm going to hand over the chair to Smaro.
Thank you.
Thank you.
So the topic of this talk is suckling dairy calf nurse cow system and gastrointestinal infection during the first grazing season. And can it be considered as a de-routing strategy to reduce anthelmintic treatment? This work is a part of the PhD thesis of Caroline Constancis, who was unfortunately not available to present herself his study. It was funded by the Co-Organic in the Grazy Daisy project. So as a background, we can say that the classical rearing of dairy calves in farming, conventional or organic farming, is an early separation from the dam, and then a breeding of calves at individual and collective level in pens with milk distribution. So the weaning classically is at around 3 months to 3 months of age, and the turnout is at different ages according to the season. From 9 to 15 months, sorry. So new practice has been developing since 2010 in Western France by farmer, not only in Western France, but also in center and in Eastern part, but especially in Western France, in order firstly to promote calf grazing and growth while decreasing neonatal diseases, and secondly to reduce work related to calves rearing. So in this new system, there is a classical first phase of rearing with a dam during 5 days around, in barn or on pasture. And what is new is a fostering phase, an adoption phase by a nurse cow in barn at around 8 days of age for the calf, and a turnout as soon as possible. One nurse cow can foster around 1 to 5 cows and 2.5 on average until weaning. So we have very few data regarding the health consequences of rearing dairy calves with nurse cows until weaning. What we know is that during the neonate phase, it is a phase which is characterized by the neonatal diarrhea, especially with bacteria, virus, and Cryptosporidium. We have 2 papers, one showing that we have a lower frequency of diarrhea in general, and a second paper which is submitted by Caroline Constancis. It's the first part of her PhD thesis, which shows that there was a lower excretion for Cryptosporidium compared to a classical system. But we have really nothing as information during the grazing phase regarding gastrointestinal nematodes. So we may have some question. Is it this system, is it a risk increase, in fact, due to a turnout on an early age and a longer grazing duration? Or in contrary, is it provoke a decrease in the risk of gastrointestinal nematode infection due to mixed pasture with adults? So I have to mention that this system for dairy calf is somewhat different from the co-calf system for beef cattle due to the ratio calves adult, which is different. So the objective of this work was to evaluate the level of gastrointestinal infection of first grazing season calves raised with nurse cows. So we work in 30 organic dairy farms located in northwestern France, as you see on the map. At the end, we had 38 groups of calves crossbred and a mean of 2.6 calves per nurse. The first visit was in August 2018, and the second visit was in wintertime from October to mid-January to perform fecal and blood sampling at housing for each calf. So we realized a fecal egg count using mini flow tach according to Quengoli and pepsinogen concentration in unit tyrosine according to Kerber technique. So what were the results? Regarding grazing system, we have 32 groups which were born in spring and 6 born in autumn. The turnout was between February to October at the age of 44 days as a mean, minimum 0 when calving was outside in pasture, and maximum 100 to 20 days. The mean duration of grazing season was around 195 days, with a huge range for these parameters from 70 days to 300 days. The weaning was at 4-9 months of age, mainly from in September for the spring calving and the rest in housing, at housing. There was a big diversity in grazing management, from a set stock grazing system to pasture rotation system with return or an invasive system with rotation. So regarding the selection of nurse cows, the main criteria were persistent subclinical mastitis for 45% of cows, but also infertility, 17%, and milking issue and lameness for 9% each. Regarding the parasitological indicators for the dairy calves, the mean group fecal egg count was 130 PG. When considering individual level, we have 38% of calves having more than 100 EPG and 2% only more than 500 EPG. This last threshold was considered as a clinical threshold and of course a production threshold too. Regarding mean group pepsinogen, the mean value was 1.12 unit tyrosine, 30% was above 1.5 and 0% above 2.5 unit tyrosine. This last threshold is considered by Kerber as a threshold with a clinical or with production problem issues. Regarding anthelmintic treatment, we have only one treatment for 17 calves out of 464. It means only 3% of animals which were treated once. So we can give some additional data obtained from the subsequent follow-up during the year 2019. This follow-up was made only on 20 farms, 400 calves with 29 groups and 4 sampling periods during the grazing season. When we consider the table and the results obtained at housing, we can see that it's quite similar to the results a year before in 2018. 131 EPG, for the pepsinogen 1.42, and we had for this follow-up the determination of ELISA ostataja in ODR, and the mean value was 0.55. Regarding the production, the mean average daily weight gain of calves was around 780 grams, and for nurse cows, the fecal egg count was 14 EPG. So this indicator for parasitological data suggests that we have a lower level of gastrointestinal nematode infection compared to standard system of dairy calves rearing, I mean weaned animal at turnout and grazing on specific pasture. This comparison was made in the same area, Western France. So on the table, you can see the value of the study for the 2 years and the value obtained by Aurélie Merlin in 2017 in standard organic or conventional system. And you can see that the value for the mean value for pepsinogen were higher in the standard system with 2.25 and 2.19. And it was exactly the same for Cetagia ODR with value higher in the standard system at 0.79 or 0.87 compared to 0.55. Similarly, the difference also was, of course, for the age at turnout in months. It was 1.5 in the system with nurse cows and compared to 8.5 or 9 months in the standard system. For grazing duration, the comparison is quite difficult because, in fact, we have a huge range of value considering the date of turnout and the calving date also. So the mixed grazing between dairy calves and adult nurse cows at the ratio of 1 cow for 2.6 calf can be considered as a diluting strategy, which can be explained by a cleansing effect of adult ingesting larvae and expressing few eggs. Moreover, suckling calves, of course, ingest grass progressively with larvae, infective larvae, together with milk intake. So a longer and an earlier first grazing season seems feasible without or with little entelmatic treatment together with satisfactory weight gain. Of course, an in-depth analysis of risk factor between groups will be performed on this data set. And I have to mention that complementary data are needed about the specific risk and issue of Dipterococcus infection, both in calves and cows, and that we are interested also in the level of immunity to gastrointestinal nematode expressed during the second grazing season by this dairy calf raised with nurse cows. So I would like to thank INRA and Pays de la Loire Region for funding the PhD grant, and Crazy Daisy Project and Core Organic for funding, and of course, all the technicians and all the farmers who participated to this study. Thank you very much.
Thank you, Christophe. We are running a bit late, so we have the most popular question because there are several. Are there any coproculture results in your study?
Yes, we have. It's mainly Cooperia and Ostertagia. So it's quite similar to the result obtained with the standard rearing system.
Okay, maybe then a quick one because there are many votes in this one. In the Netherlands, we had a massive drought in 2018 and 19, having a huge effect on GIN infections. What was the situation in France in those years? And could you compare, therefore, with 2017 because of the droughts?
Yes, you're right. It's quite difficult always to compare different pasture season. And unfortunately, we have some drought in this area for many years. So including 2017 and 16. So I think it's more or less comparable, but of course, it's a problem to compare different seasons. I agree with that, of course.
Thank you, thank you. And then we go quickly to Cynthia Massin from Las Palmas, Gran Canaria.
So, I'm going to talk about our study about a vaccination in 2 native sheep breeds with our recombinant vaccine. Among the alternatives to Antelminted, we find 2 potential options in the use of vaccines and the use of resistant breeds against parasites. So here in this experiment, we have used a recombinant vaccine against Teladoseidia circumscripta, which had previously conferred protection in tertiary cross lambs, but it didn't confer protection in the younger lambs, and it had some individual variability. On the other hand, we have 2 native sheep breeds in here where we are in the Canary Islands that has shown differences in resistance against Haemophilus contortus, being the more resistant breed, the hare breed, and the more susceptible, the bull breed. So we have combined these two alternatives to compare the efficacy of the vaccine in both breeds at different ages. In order to do that, we carried out two trials. In the first trial, we had lambs of 6 months old and from both breeds, and we separated each breed in vaccinated and control groups. And in the second trial, we did the same, but with the 3 months old lambs. We followed the same experimental design as Nisbet and collaborators, where we vaccinated them 3 times, and then it followed with the trickle infections of the parasite, and lastly, we took stool, blood, and postmortem samples. So all of this led us to the following results. First of all, I would like to remark that we are going to follow the same color code for all of the graphics in this presentation, being the yellow and red line. Well, they correspond to the susceptible breed, being the red line, the vaccinated group of the susceptible breed. And the green and blue line correspond to the resistant breed, being the blue line, the vaccinated group. So here in this graphic of cumulative fecal egg count, we can see that there were some reductions of this variable in the 6 months old lambs when they were vaccinated in both breeds. But also we can see that there is an effect of the breed resistance when we look at the control groups, and if we compare it, there were significant reductions here. Then in this other graphic of the 3 months old lambs, we only saw a reduction, but no significant reduction, only in the resistant breed. About the nematode burden, here, if we look at the graphic of the 6 months old, we can see that there was a reduction when vaccinated in the resistant breed, but this reduction wasn't significant, and only it was significant when we combine the effect of the breed and the effect of the vaccine, if we compare it to the susceptible breed. In the younger lambs, this reduction that we saw here in the within the resistant breed is significant, and when vaccinated, obviously. So this could suggest that the vaccine is inducing this response here. Also, we look at the worm length, and there were interesting results. As you can see here, there is a reduction of the length, a significant reduction in the susceptible breed, and it reaches almost the same length as the resistant breed in the older animals. While in the younger ones, the reduction happened in the resistant breed, and it was significant. So this suggests that the vaccine is inducing, is reducing the worm length in the susceptible breed at older ages, and in younger lambs, it seems to reduce the worm length in the resistant breed. In these graphics follow the same pattern as the previous one, since they are related. So briefly, to summarize what I've said until now, the vaccine seemed to induce a protection in the susceptible breed and in the older animals, reducing length and eggs in utero. However, in the younger lambs, the vaccine seemed to be affecting the resistant breed, reducing several parasitological parameters. So all of these reductions are linked to the immune mechanisms that we also looked at, and we found that we observed the specific IgA against larval stage 4, where here you can see that there is a higher production of this IgA when vaccinated in the resistant breed of the older animals. And this wasn't the breed where the vaccine seemed to be reducing significantly the parasitology. However, when we looked at the correlations, they happened only in the vaccinated group of the susceptible breed, where the vaccine seemed to confer protection. In the younger animals, we didn't see any remarkable data, and neither we found any correlations, but there was a correlation in the vaccinated group of the resistant breed of IgA against L3 stage. So we think that this vaccine is inducing a response that is targeting the larval stages and is similar to the natural immune response of animals, where it's described that the IgA targets the larval stages too, regulating worm growth and prolificity. So we also observe globule leukocytes, which are mast cells, activated mast cells that we can find in the basal mucosa. We didn't see any differences in the number of globule leukocytes, but when we looked at the correlations, we found several negative associations in the vaccinated group of each age, where the vaccine seemed to be inducing the response. So also, we did find other negative correlations with parasitology, but we think that this is linked to the fact that the globule leukocytes are involved in the natural immune response of the animals, taking part of the rapid larval rejection. So our main conclusions in this study were that the vaccine efficacy depends on the age of each breed. The mechanisms induced by the vaccine are similar at different ages in both breeds. And this could imply that we could combine these two alternatives in order to obtain more data and keep improving the prototype vaccine, and also to integrate them in the future. Lastly, I would like to thank you for giving me this opportunity to give this talk, and also to the Modern Research Institute and my group at the Universidad de Las Palmas de Gran Canaria. Thank you.
Thank you, Cynthia, for the very interesting presentation. We have several questions for you. Well, I start with the most popular. And based on which criteria you chose to test these age groups, 3 and 6 months?
Well, in the previous trial that Nisbet and collaborators did, they found that they had the vaccine seemed to work in this I think in the 6 months old lambs, but it didn't work in the younger ones. So that's why we did the second trial, where we had the younger lambs.
And the vaccine was only injected once?
No. Three times along the time.
Okay.
And it was each 3 weeks. Every 3 weeks we vaccinated them, and then we infected later.
Thank you. So we can start with the poster presentations. Anna, you will be doing the first one.
I would like to start by thanking the organizers to give us the opportunity to present our work here. The aim of this study was to evaluate the FAMACHA method for target selective anti-helminthic treatment in black and white merino sheep in the Alentejo region in the south of Portugal. To do such paired fecal and blood samples were collected in 26 merino black and merino white farms for fecal egg count, coproculture, and packed cell volume determination. FAMACHA scores were assessed using thresholds 3 and 4, and clinical anemia was determined as PEG cell volume less than 27%. As preliminary results, we observed a significant correlation between FAMASHA scores and PEG cell volume for both breeds. PEG cell volume significantly correlated with fecal egg count, but not with FAMASHA scores. Overall, sensitivity and specificity in detecting animal needing anti-helminthic treatment was approximately 57% and 41% for white and black merino sheep, respectively. Our coproculture results show that Haemonchus contortus was the less prevalent and representative species. As a take-home message, we'd like to finish by saying that the FAMASHA method may not be suitable for target selective treatment in the Alentejo region due to an apparently low prevalence of Haemonchus contortus. Thank you very much for your attention.
Yes, hello, Charlotte from University of Copenhagen here. I'll be telling you about the effects of seaweed inclusion in the feed of limited burdens in pigs. So building on our previous in vitro work, we tested our most promising seaweed in vivo using pigs. So first we set up a small study where we tested fermented and non-fermented seaweed in 5%. On co-infected pigs. And if you press next. Yeah, we also did a larger 2x2 study with 8% seaweed inclusion, also on co-infected pigs of 28 days plus 8 days inclusions with a parasite. Yes, next. So the results from the first study showed that they had the seaweed inclusions had no effect on parasite burdens, but we did see about a 40 to 50% reduction in egg excretion in both seaweed-fed groups. If you press next, unfortunately, when we did the larger study, we couldn't replicate this decrease in egg excretion, and also we saw the same pattern with the worm burdens, but we did see a decrease in the hatching of the Oesophagus dentatum, as well as a decrease in milk spots in the liver. And next. And lastly, we also did flow cytometry to see how this affected the white blood cells, and we did both on blood and lymph nodes. And here we didn't see much effect of the seaweed inclusion, only on uninfected pigs, where we saw a slight increase in T cells and a slight decrease in monocytes in the blood. Thank you.
Thank you, Charlotte. And let's move to the next one.
Okay, I'm Filip from University of Novi Sad, Serbia, and I will talk about essential oils and their possible role in controlling gastrointestinal nematodes of sheep. In this study, we used one sample of Juniperus communis and 2 samples of Achilles mellifolium essential oils. We evaluate their anti-helminthic potential against sheep gastrointestinal nematodes by using in vitro egg hatch test. And also we did GCMS, gas photography mass spectrometry analysis to determine their chemical composition. And in the table 1, you can see the main represented compounds in each tested EO, which are responsible for their ovicidal activity. Next slide. And here in this table, you can see the results of the egg hatch test. You may notice that the inhibitory activity of the tested EO samples on egg hatching was very high and dose dependent, whereby the Juniperus communis EO showed the best performances. Also, you may notice that the efficacy of essential oils depends on the plant species from which it is extracted, and also from the chemotype of the same plant species, which is related to the different plant grown conditions and also environmental factors, source of the essential oils, etc., which can lead to the differences in their chemical composition and efficacy. So we can conclude that the essential oils of Juniperus communis and Achilles mellifolium have a potential to be used in the control of the sheep gastrointestinal nematodes. And also this study highlights the possible importance of herbal plant products in combating anti-helminthic resistance. Thank you.
Thank you also. And we go to the final one for the poster session by Alexandra.
Yes, thank you. Thank you. Hello, everybody. A special hello to Mordun of team. Thank you for the opportunity to present our work. My name is Alexandra Vergles-Rataj, coming from Slovenia, from veterinary faculty at University of Ljubljana. And last year I spent, thank you. Last year I spent a few months at Mordun Institute and was working with Fiona and her team. The first experiment we did was adding L1 larvae, Haemonchus contortus, and bacteria, Chrysobacterium nematophagum, in 2 concentrations onto the grass grown in pots, incubated for different hours. And we also created a condition score for determining the damage of larvae. The second experiment was to determine the effect of Chrysobacterium nematophagum on free-living nematodes in fresh pasture samples. In the first experiment, L1 larvae damaged, of course, and the number of nematodes in the second experiment were reduced. We have also here pictures. One is a normal Haemonchus contortus L1 larvae, and another picture is a larvae which is damaged. Thank you.
We also thank you very much. And since we have a minute left, there is one question for Charlotte. If there was only one Esophagostomum species in your pigs, Charlotte?
Yes, it was only Esophagostomum dentatum.
Okay, then, thank you. Oh, and we have the real chair back, so I will hand it over to Eric to continue with.
Thank you, Smaro, and thank you to all our presenters. So we are on to the panel section. We're fortunate to have a wide array of expertise in our panel discussion. We have a mixture of researchers in parasitology, farmers, vets, and industry. So we will run this much as we did in the previous sessions. We have some pre-prepared questions for each panelist. So I'll introduce the panelist and ask those pre-prepared questions, but please use Mentimeter then, and we will take questions that are most voted. So I first want to introduce Hervé Ost, who is at INRA and École Nationale Vétérinaire de Toulouse, in Toulouse, and many of you will know Hervé for his track record of work, particularly in plant secondary metabolites and nutraceuticals. So we've asked Hervé to expand on 2 questions initially. So welcome, Hervé. Thank you for joining us.
Thank you, Eric. How are you? Fine.
The first question is, what are the current and future possibilities regarding plant-based therapies and nematophagous fungi in ruminants?
I think first it's important to define what is plant-based. I mean, it can be nutraceuticals, but it can be also essential oils or phytotherapeutic drugs. So it's important to make the difference. And again, nematophagous fungi, of course, we are thinking of them Dictonia flagrans and all the work done by Copenhagen University, but there are other possibilities and other species which can be used. Then in regard of the current possibilities and of applications, if I'm using the grid which has been presented in the introduction, I think we have scientific evidence on efficiency, on the lack of toxicity for the animals. We have some knowledge on the mechanism, and in the efficiency, we have also some information on the possibility to use this solution against a range of nematodes. On the other hand, for the on-farm application, we have also both for fungi and plants, probably information on how to use them, how much do we need to apply, how long do we need to apply, and sometimes we have also information on when is it better to apply this sort of solution. Saying that, I think there are still a lot of possibilities and questions to solve for the future. one of the key questions for the two alternative solutions is probably the variability in results. And for this, and to try to solve this question, we have to better understand the mechanism of action. For the plant, for example, is what are the secondary metabolites which are active? How can we dose them? And for the mechanism of action, it's also how does it affect the worms, the different stage of the worms, and both the function and the structure of the worms. But this is worth to be addressed because it can give some possibilities of application on farm. For example, it's important for taking the example of tanniniferous plants. It is important to be able to characterize a resource before use and to have also a cheap way of measurements. If it's too complex, sorry, it will not be adopted by the farmers. It will be considered to be too costly. So that's one of the points. The second point is also, and it has been evoked previously, particularly by Barbara's talk, we have a lot of information on the efficiency and possible mechanism, but one of the points which has not been addressed is toxicity, possible toxicity and residues affecting the consumer. So of course, it is depending on the form of plant which will be used, it's less a stress probably for fungi, but if you think of essential oils and herbal drugs, one of the points is probably to have more information on the possibility of transfer of these metabolites in the food, and particularly for milk, for example. Some questions are, can it affect health of human, and also possibly also like cheese processing can be affected. And the last point is also just a few ideas to get better coordination with the socioeconomics aspect and to make links with WG2. Some solution can be acceptable for meat production of sheep, but less in dairy use. And the acceptance by the farmers is also a key issue. And commercially, the organization of production can be a bottleneck. I hope I was not too long.
No, perfect. Thank you, Hervé. There are questions appearing in Mentimeter already, which is great. The second question I have for you is partly answered already, but in which production systems are these applied today? I think you've answered that with your examples, but could they be of wider use?
So I think clearly the work done by Stig and his group in Copenhagen has shown one of the interests of the fungi is that it can be applied in a wide range of host species. And this is one of the interests of this solution. And it's also active against a wide range of different nematode species. For plant, it has been mainly used against ruminants, particularly in sheep and goats. It began to be used in horses also. Some of my colleagues in INRA are working also on possibility to apply it in horses. And yeah, herbal drugs are also used in poultry and pig also by Stig's group. So there's a wide range of possibility on hosts. And just as an interesting anecdote is one of the key possibility of use is a zoo animal, because they are very expensive, high value, and it seems to be a good solution for this sort of animals.
Thank you. There's a question on plant-based products maybe being similar to anthelmintics, and do you think that in the same vein there will be issues we run into with resistance or lack of efficacy for plant-based products?
I think we have to keep that in mind with any sort of possible solution. It has been evoked for genetic resistance, or it has been evoked also for fungi, I think. For plants, we have circumstantial indication showing that it can, for tannin, we might, in collaboration with colleagues in Mexico, we suspect that some of the nematodes which have been in contact with tannins for long, several centuries, let's say, might be more resistant to the use of tannins.
Thank you. There's a question on whether there are any modeling data assessing the combined effects of using partly effective nutritionals and highly effective anthelmintics concerning reduction of use of anthelmintics.
I send you back the question. I think the guy who is a specialist in modelization is in front of me, but it's sure it's going to be really interesting to combine this in models.
Yeah, there's very little that I know of at the moment, but certainly I think it's a field that should be explored. And the final question for you, Hervé, we will get to the questions that we don't have time to answer later, but the top voted question left is, in what sense do you consider herbal so different from anthelmintics when both are actually some sort of chemical treatment?
Yeah, I agree. I mean, it's on the other hand, herbal can be also mixed with the diet. So it depends more or less on the way you are giving the herbal and essential oils also to the animals. But in a way, yes, it's if I have to make a range, anthelmintics and herbal drugs are targeting the adult worms, and the main objective is to eliminate the worms. The use of nutraceuticals is a bit different because it's more preventive and it's offered to the animals. So it's depending also on the voluntary feed intake by the animals. And in a sense, the question of regulation and possible residues is probably more important to address with herbal drugs and essential oils, I think.
Thank you, Hervé. That's perfect. We'll move on if that's okay, and invite Bruce in if Bruce is here. So Bruce Thompson has joined us, I hope. He's a dairy farmer in Ireland, and he's been very active in exploring alternative ways of controlling helminths, including learning lessons from New Zealand and maximizing use of ecosystem services. So hopefully he can share with us the perspective of an engaged farmer in this sphere. And I have 3 questions to put to you, Bruce, and then I'm going to monitor more in the Mentimeter. Right, so welcome and thank you. First question is, as a farmer and thinking of the potential of different options, so targeted selective treatment, diagnosis, plant-based control, vaccines, the sorts of things we've heard about, what are the expectations of farmers for these new control approaches?
Okay, so within farming communities, the efficacy of the current anthelmintics failing is not fully realized yet financially. So with 3 generations of a proven approach with using anthelmintics, it's hard for farmers to look at alternatives, particularly with the risks that can be involved with changing away from a proven method. The thinking is that resistance is years down the road from us, and in terms of the products, then advice is readily available there, whereas the alternatives, the advice is not readily available. So yeah, and very often the alternatives being used can be associated with non-productive type of farmers. So there's a bit of a stigma there as well. Yeah, so that's kind of the current expectations amongst the farming community.
There's a couple of really interesting points there. So linking on from that very nicely, actually, do you think complex solutions such as combining these different approaches can be made accessible to farmers?
Yeah, well, we're looking at some of the complex solutions that would be the likes of resistant genetics in animals. So we have ICBF, which is the Irish database for animals, animal genetics. Last year launched a scale to show fluke resistance in certain sires, and we have there's grazing practices there available that like traffic light grazing as a novel grazing techniques in order to create avoidance from parasites while creating adaptive resistance within the animals. And of course, encouraging dung beetles then, which are kind of my favorite, to clean up pastures when the helminths are at the free living stage. Diagnostics then as well. So farmers are not really aware of all the diagnostic tools that are available, or the cost of using these, or interpreting them and bringing them back home to the farm. Practicing refugia, another tool that's not used on farm, but all these complex solutions that I'm listing there are readily available and workable on farms, because it's what we've done on our own farm to reduce antibiotics.
So they're readily available, Bruce, but what do you think then are the main bottlenecks to implementing these solutions?
Okay, well, I suppose there's a lack of promotion maybe of these solutions. So we're not fully aware of the upcoming risks in terms of antibiotic resistance, because it's not very apparent on farms that we haven't got acute antibiotic resistance, so it's subacute. We're not aware then of the financial savings that we could be gaining from reduction in antibiotics, and creating better animal welfare to reduce antibiotic usage. Confidence then is another one. So we hear of horror stories of some farmer a few miles away that didn't look at his animals well enough and ended up losing some with lungworm, for example, and that puts the fear of God into a farmer that is afraid not to use these products. So a confidence thing. So I suppose that leads me on to a vet-farmer relationship, where we currently have a relationship where the vet is called for sick animals onto a farm, as opposed to paying our vets to keep the animals healthy. We're paying them to make them healthy. So I suppose we need a change of mindset of that. There's probably a lack then of real-time regional information then on parasite trends from, for example, the likes of processing facilities. So your ELISA blood tests from young stock in an area, if we see readings starting to rise, if that was on a real-time database, that information could be made available to veterinary surgeons to pass on to farmers, and linking in them with diagnostic laboratories. I suppose then there's little value then put on some of the alternatives, like our beneficial insects, and probably little belief in some of these alternatives. So I suppose promotion is probably the buzzword, really.
Thanks, that's perfect. We'll just take the top question from Mentimeter. There is one that asks whether you need more guidance on utilising these, but I think you've answered that positively. There's a question on how you monitor antibiotic resistance status in your herd.
So currently what I'm doing is fecal egg count reduction tests. That's basically it.
And what's your experience with them?
Sorry, we don't use a lot of antibiotics anyway, so we're only testing calves there, and you're only looking at 2 or 3 doses in the year, so it's not going to be a very comprehensive study. Yeah,
that's great, thanks. No, that's fine. I mean, there is that question on, do you need more guidelines? And you mentioned that, but maybe you can expand on, apart from better information from the vet, what sort of guidelines on using these alternatives do you think would be most useful for farmers?
Yeah, well, I suppose maybe a consultancy role is probably there with the vet, and a framework for the vet to come up with a plan at the start of the grazing year that is adaptable to the conditions that are put in front of the farmer as the year progresses. And so the sharing of information then in terms of where the animals are grazing and risks that are being brought in front of the vet around from different farms.
Thank you, that's wonderful. Much appreciated, Bruce. We're going to have to move on to keep the time, but some of those questions that have come up on Mentimeter, we'll try to report back to the group on, but it's wonderful to have that perspective. It's confirmed some of what we think, but it's challenging us with some new perspectives as well. So much appreciated. We move on to the next panelist, and this is Thomas Curtin from Swetis. He used to be one of us. By one of us, I mean an out-and-out parasitologist, but he's since moved to industry and has a different perspective. So I have a couple of questions for you, Thomas, if you're ready. You're not muted, Thomas, but I can't hear a thing, so it might be a technical problem. In that case, while you're resolving that, I will come back to you, Thomas, but I'll move on to the fourth panelist, Athena Trachili, who is representing the European Union of Veterinary Practitioners. She's a vice president. She's also the president of the Pan-Hellenic Veterinary Association. And the European Union of Veterinary Practitioners represents across borders in Europe the veterinary profession and seeks to improve standards, including through professional education. So very relevant, following on from Bruce's comments, that vets need to be better informed and more proactive perhaps in getting these messages across to farmers, and to support them in their efforts. So Athena, welcome. Thank you for joining us.
Good afternoon. I hope everybody's fine. Thank you for inviting me in this meeting, in this webinar. It's a great honor for me to speak and deliver a talk about how the general practitioner, the veterinarians, can contribute to sustainable parasite control from our perspective. As a vet, I speak as a vet and also as a vice president of UAVP. I think the role of the general practitioner, the veterinarian, is of great importance, considering that what happens in the stable ends on the consumer's plate. And it is important that the vets, the general practitioner, are the scientists that come into direct contact with the farmer. And we are those people, the doctor that has to persuade the farmer to apply sustainable parasite. So I said that the vets, the general practitioner, are the scientists that comes into direct contact with the farmer. And this is the person that has to persuade the farmer to apply sustainable parasite control practices. Vets, the general practitioner, therefore, are the one who first, they must be convinced, we have first be convinced of the need to implement sustainable practices, and then be trained, the vets I mean, on innovative approaches, and especially on the use of diagnostic data, and I mean parasitological, pathophysiological, immunological data for the implementation of target approaches. So the vets must be properly prepared so that in turn they can convince the farmers through. First, I have 3 signs, I have 3 points, very important points that I have to mention. We have to highlight the problem to the farmer and the positives that will arise if he make a sustainable parasite control. Secondly, highlight the possible financial losses suffered by the farmer from not using sustainable practices. And the third very important issue is the promotion and the advisory support in the application of the methodology of new sustainable practices in a simple and understandable way, so the farmer can convince that it's not very difficult to do it. But first, the vets has to show it. Dear colleagues and ladies and gentlemen, I think everybody knows that the use of veterinary medicines and other medicines is vital. These drugs are, on the one hand, a unique weapon in the hands of the veterinarians in the practice in our daily act to restore animal health. On the other hand, through the preservation of livestock, we contribute to the development of each country. So we have to take care and use sustainable parasite control. This is my answer. Thank you.
Thank you very much, Athena. It's very interesting to hear the farmer and then the vet, particularly the farmer saying, we're already trying to do this and we need more professional support, and then the vet perspective to equip ourselves and to persuade the farmers. Maybe there's a gap there because it seems like you're pushing at an open door, and maybe it's back to us to provide the technical support and advice to the vets also. Do you think?
Yes, but I have the answer. I think the problem is that if we had a new legislation system in every country that says that every farm must have his farm veterinarian to do the management, to prevent, to do the husbandry, to do the welfare issues, everything in his farm, and this farmer has some incentives from the government that could help a lot. So I think until now, not in every country, but in a lot of countries in the European community, there is the farm visitation system. So every farm must have a veterinarian, a general practitioner responsible for his farm, and this veterinarian is responsible for the treatment and make all the prevention schedule and all the sustainable approaches to his flock. This would help very, very much. So the farm would have a special scientist to help him.
That sounds like it would be very useful, different routes to get there perhaps. So Johannes, I see a mess. Thank you, Athena. I think we will move on to some thoughts now from Thomas, if he's able to be heard now, particularly on the outlook for future anthelmintics and what is needed to make them more sustainable. Thomas, over to you.
Thank you for providing the opportunity to join this forum. So, Eric, the outlook for future anthelmintics, and we're definitely focusing on ruminants here. So there is always appetite, I think, from the industry to start a development program for a new anthelmintic. But more specifically for ruminants, it might be good just to highlight a couple of items that we need to take into account. So first of all, I mean, is there a real need for a new anthelmintic? And I know that, I mean, within this fora, we're sometimes a little bit biased with our focus on anthelmintic resistance. And obviously from the market perspective, from a farmer perspective, parasitology and even anthelmintic resistance is maybe not their only issue. So the demand for new anthelmintics is there, but it's not always as a top priority for development of new products. So that's one thing. And maybe this is, Eric, best illustrated to some extent by the uptake of Monepantel and Dercantel as new products in the sheep markets. Those products are doing quite well. Actually, but it's not that they have been adopted at a very large scale. I mean, sheep farmers are still using a lot of the white and yellow drenches, even though they are fully aware that they are not as effective anymore. So yeah, I mean, there is a need, but I would also call it a little bit of a perceived need sometimes from an anthelmintic resistance perspective. So that's one thing. The second thing that I would certainly like to highlight is I think we have been spoiled a little bit with all our good products, especially MLs, very effective against a lot of parasites, a lot of stages, wide spectrum, nice persistent efficacy, which is commercially very attractive. Maybe not always from an anthelmintic resistance point of view, but commercially it is. So if you develop a new product, how do you match that? How do you make your new product as attractive as some of the old ones? So I'm just throwing it out there. I mean, it is a question that regularly comes up when we are discussing new products, new product profiles for anthelmintics. But it's definitely not a kill issue, but it's something we have to take into account. And then as parasitologists, you might have noticed that a lot of new products came on the market for companion animals lately. I think the market has been swamped. And that's also something that we need to acknowledge, is that in production animal, the development cost for any product, including anthelmintics, is much higher compared to development cost in companion animals. And this is mainly driven by MRL, so withdrawal time, maximum residue limits, to some extent user safety, especially for injectable products, that is an issue, but also environmental safety. This is probably underestimated by a lot of people, but a lot of antiparasitic products also have activity against a lot of environmental organisms, and that risk, which is something we need to assess at every level of development, but also at when we are going through the regulatory approval process. So that's definitely a risk that is sometimes decreasing the appetite to go into new product development for antiparasitics. So maybe to conclude on this, Eric, there's always appetite for new products, but obviously I think the world changed a little bit between the 1980s and now, when we had a large influx of very good products with a lot of benefits. I think the benefits decreased a little bit and the risks increased a little bit for new product development there. So it's definitely not a red flag, but it's also not always a green light to go ahead with any new project.
Thank you, Thomas. I don't know if you're reading the Mentimeter, you seem to be anticipating all the questions, but there's one that maybe your discussion of the difficulties in developing new products leads directly onto, and that is, how willing is the industry to move from therapeutics into diagnostics?
Yeah, I think that's a very valid question. I think Bruce also touched on that. I think customers evolved from just being pleased with treatment to focusing more on prevention and management, and that also includes diagnostics. And Eric, that is definitely a message that is well heard by industry. I'm not advocating our company alone, but I can tell you from my experience in our company, diagnostics is definitely one of the fast growing areas here. And we just actually launched for parasitology a diagnostic tool, which is based on microscopy, which uses artificial intelligence. So you have a lot of automated diagnostics possibilities there. It's kind of still new and has to grow and expand, but it's definitely an area that industry is interested in.
Thank you very much. We're up to time now. So it's very nice of you, by the way, Thomas, to address all your answers to me personally, but there are 134 other people who...
I know, but I see you, so that's easy. Thank you.
Perfect. So I'll formally close this session, but Johannes has invited those who are able to stay on for a photograph, and maybe you have some Mentimeter results to share also, Johannes, but I'll formally close this panel session and the session as a whole, and hand back to our very capable chair, and thank Johannes for all his efforts in organizing this meeting.
Thank you, Eric. Yeah, I'll keep it very brief for the Mentimeter. First, I'll try to share my screen. So, which are important criteria to speak of sustainable parasite control? Well, I'll just try to read some inputs without any attempt to cover the most important ones. Monitoring parasite infection levels, affordable, ease of implementation, economy, animal health, animal welfare, ecology. Okay, so please provide us with more comments. I'll move to the next point. This is perhaps something we didn't discuss in so much detail today. Which are the most promising technologies to improve future parasite control? So I see vaccine very often mentioned, automated fecal egg count, grazing management, targeted treatment, ease of diagnosis, nutraceuticals, and so on. So, okay, thank you for all the inputs received. And this is, I think, the last one. What kind of guidelines would you implement to translate research into practice? A holistic approach taking into account animal health, pasture management, environment, anthelmintics management, genetics, and everything else. So that's the ideal future, I think, that we're working to. So as you have seen in the Mentimeter, you can also provide just your experience on the meeting. how you would rate it, and potential suggestions how we can improve future meetings. So also thank you if you could leave your comments there, but I will not share this for the moment. So I would also like to thank you everybody for participating. To me, I've enjoyed it very much. The meetings, I learned a lot of things. I hope the same for you. The next time we hope to interact is at the WAVP in July next year in Dublin, if all the restrictions allow. But that is when we plan to have also a COMBAR session at the WAVP, and I hope to see many of you there. Thank you very much.